Hello, my name is Dr. Stan Martin, and I'm the Director of Infectious Diseases for Geisinger, and I'm here to talk today a little bit about coronavirus. Let's talk about testing for SARS-CoV-2. Right now, we think of it in one of two ways, either a patient who's sick enough to be in the hospital or somebody who's not sick enough and can be treated or observed as an outpatient. If you're in that latter group and you're doing well enough, then the patients that we want to test are going to be people who are in that high-risk group, the elderly, people with underlying heart and lung problems, etc. Obviously, if you've had a known exposure to a COVID case, we want to consider you at a potentially high risk for having this disease and want to test you. Also, if you are a healthcare worker, if you're one of us, we also want to test you. However, if you don't meet those criteria, or, and this is very important, if you have no symptoms at this time, we do not want to test you. The test is unlikely to be of any value in that situation, and unfortunately, we are still struggling to have an adequate number of tests available, not just here at Geisinger, but this is, unfortunately, a nationwide problem. So keep that in mind. If you're thinking about should I get tested, ask yourself, do I have any symptoms that could correlate with COVID? If the answer is yes, and you're a healthcare employee, then yes, we do want to test you. For inpatients, for people who are being admitted to the hospital, if they have a severe enough case of disease to be admitted, then we want to test you. If, again, you have symptoms that are compatible with the infection. Oftentimes, these can overlap with other diseases, and so your doctors may want to do a number of tests looking for the cause of what may be going on in that situation. And those, of course, have to be tailored to the individual. The test currently is being done with a swab. So there's a nasopharyngeal swab, and the swab is inserted into the nostril to the back of the nasopharynx. And it's important that it gets far enough back there in order to pick up this virus.